morning. Hi, my name is Tandi, and this is a blog entry from my channel, Umoya. Welcome to my channel. Right now, it's a variety channel where I have vlogs and entries related to health and wellness. Today, I would like to make a vlog entry about advocacy. As you know, it is 10 years since the Affordable Health Care Act has been established, or otherwise known as Obamacare. Today, I would like to talk about just personally how Obamacare has affected me. Now, it was enacted on March 23rd, 2010, 9. So it's been about 10 years. 10 years just passed, and 37 states have expanded Medicaid because of the Affordable Health Care Act. That's 22 million people who now have health care who otherwise wouldn't, because they wouldn't be able to afford the coverage. I would just like to cover 3 points of how the Affordable Health Care Act has impacted me. First, how now I'm able to go to a regular doctor and get my healthcare visits covered. 2, how my medications that are really expensive are fully covered. And 3, how I'm able to gain access to mental health services because of the ACA through Medicaid expansion. First, the ACA has allowed me to go see a doctor regularly, which is critical for a woman like me living with HIV. Medicaid has since expansion has become the most largest health insurance provider for people living with HIV, especially if they're low income. Now for me, I thank God for my Medicaid because going to the ID doctor is necessary for me. I go there once every 6 months. I take my medication as directed. And because of those simple steps and building rapport with my doctor, I'm healthy. I'm undetectable. I'm virally suppressed. And I'm able to live a long and healthy life. And that's important to me. That's important that I have a quality of life where I can live with dignity and I can live it just as good as I would if I was HIV negative. Now, a primary care visit to an infectious disease doctor could estimate, just for one payment, it's like $284. And I found this on the average cost of living on the internet. Well, on an internet site called debt.org. And that's expensive. That's $284 taken from a limited budget that I use for everyday expenses, such as rent, utilities, transportation, food, etc., etc. Without the ACA, we would go back. And this would happen even if it's repealed, God forsake, if it's ever repealed. I don't want that to happen, because then we'd go back to the days where people have to start choosing my rent or my health care, my food or my health care. And that is a tragedy if we ever go back to that. I thank God that I can go to my doctor and get all my needs met. And I don't have to ever worry about choosing between having a roof over my head or going to see my doctor. It also covers my labs, which is an essential part of my care. My labs tell my doctor, how well I'm doing on the medication, how my body is adjusting to the medication, how much particles of the virus is in my blood, whether it's suppressed or not. So the 2 most essential tests tend to be the most expensive. But because I have Medicaid, they're fully covered, and I never have to worry about paying a huge bill. So in an initial healthcare visit, the doctor tests you for everything. So that would be your highest bill. That would be Medicaid's highest bill, because it could range from $700, depending on how much tests the doctor orders, how comprehensive the doctor wants. And that's expensive. That's a scary ass bill to get. So I'm grateful that Medicaid covers all that. So I don't have to freak out and have a panic attack and worry about how am I going to pay for my own labs. Or some shit, should I even go and take the labs? Some before the ACA was enacted, that's what people would do. They would just avoid going and getting their labs altogether because they couldn't afford it. Now, lastly, the ACA has given me an opportunity to support my mental health by covering the costs I need to go see a therapist. Now, dealing with HIV, it really takes an emotional toll on you, especially initially. It's a lot. And going and getting that extra support really makes a difference in the quality of your life. And it also makes a difference in how you're able to see, it gives you different coping mechanisms. But going to the therapist is expensive, especially if I didn't have the extra support that Medicaid gives me. I went to my therapist once a week for about a year. Now, the cost of seeing a therapist could range from $75 to $200, depending on the licensed therapist. And that's ranging for about $3,600 to $9,000 a year if you go once a week every year. That's a lot. That's a lot of money that I need from my limited budget. And that's not me alone. Because I'm was able to see these therapists, I was able to talk through and problem solve and resolve the emotional issues that were within me so that I can be better for myself. And in turn, I can be better for my family and society. And there are studies that show this. In the American Internal Medicine Journal, it stated that since the ACA was enacted, people living with chronic health conditions, such as childless adults, were able to enjoy a better quality of life. And if the Affordable Health Care Act was ever repealed, these effects would reverse. So in the end, I'm grateful that I can share my story with you and let you know how it's impacted me. But the thing is, I am just one of many it's impacting for the positive. I know that there are people there that they disagree and they have a right to their opinion. But for me and for other women living with HIV, the ACA has been a game changer. It's really been a leg of support. And I'm grateful I lived in a state that decided to expand and support me and other women living with HIV, because we are human, and the rights of women living with